Hey guys, it's John with Yellow Brick Road. I want to talk to you today about shock, the 3 basic steps you do to prevent shock. Basically, we call it the Boy Scout steps, so it's basic first aid. You want to lay them flat, elevate their feet, and you want to keep them warm. So the first step in treating shock is to lay them flat. So the reason you lay them flat is so that if they're passing out, they don't pass all the way out. And also when you lay someone flat, all of a sudden you take their blood pressure and you level it out. Once you lay them flat, the only contraindication to elevating their feet is if they have a head injury. So if they have something wrong with their head, you do not elevate their feet. However, if their head is fine, you would elevate their feet at this point. You want to elevate their feet 6 to 12 inches. So 6 to 12 inches. You can use anything from a junk bag or a chair or anything, but you elevate their feet to allow the blood to come back to the trunk area. So lay them flat, elevate their feet, and keep them warm. Part of keeping them warm is what we call burrito them. What you want to do is wrap them in a blanket. You don't want just the blanket on top of them. You want the blanket also under them. So make sure the blanket is under them. You may have to log roll them, put the blanket under them, then take the blanket and roll them in the blanket. I will use multiple blankets and try to put some kind of barrier device under them so that you keep them warm. Always remember that if they've lost blood or if they're in hypovolemic shock, what they're going to do is be low on volume. So if their blood is low, you're going to have to worry about all of their container getting cold really fast. And remember the lethal triad. I'll make a video on, that's not a triangle. I'll make a video on the lethal triad where it talks about hypothermia and coagulation and shock or going into hypovolemia. Yes, hypovolemia. So that is the basic Boy Scout steps for treating shock. It's lay them flat, elevate their feet, and keep them warm. Until next time, remember, PPE, seen safe, number of patients, MOI, NOI, additional resources.